My name is Dr. Ronald Weiss. I'm a pathologist and professor of pathology at the University of Utah School of Medicine and its ARUP Laboratories, where I practice hematopathology. I want to talk to you today about the Choosing Wisely campaign. A strong case has been made that the overutilization of unnecessary, low-value healthcare services contributes significantly to the unsustainable costs of America's healthcare system. Some well-informed estimates have indicated 25 to 30% of total costs are due to wasteful spending. This equates to hundreds of billions of dollars each year. Embedded in these numbers are diagnostic tests, including those performed in clinical laboratories, which do not contribute to patient diagnosis and management, and in some cases lead to unintended consequences and potential harm to patients. For these reasons, the American Board of Internal Medicine Foundation joined together last year with Consumer Reports and more than 24 medical specialty societies, including the American Society for Clinical Pathology, to develop lists of those procedures and tests that physicians and their patients should question, initiating a dialogue intended to lead to more informed choices for care management. This campaign has been called the Choosing Wisely campaign. For example, the list of the 5 tests identified by the ASCP include: do not perform population-based screening for 25-hydroxy vitamin D deficiency. Do not perform low-risk human papillomavirus HPV testing. Avoid routine preoperative testing for low-risk surgeries without a clinical indication. Only order methylated septin-9 on patients for whom conventional screening diagnostics for colon cancer are not possible. Do not use the bleeding time test to guide patient care. This list and those of other medical specialty societies all point to tests and procedures that, based upon a review of the published evidence, are of low clinical value and for which there is documented overutilization. This is a very worthy effort that represents an opportunity for physicians to counsel their patients on care designed to optimize clinical outcome and minimize unnecessary cost. It is also an opportunity for pathologists and clinical laboratory scientists to identify for clinicians and patients other opportunities like these to reduce unnecessary utilization of costly healthcare services in the laboratory. This is an important part of our value proposition to high-quality healthcare delivery. But identifying unnecessary utilization and wasteful spending is only one side of the coin. The underutilization of necessary tests and procedures is often lost in this dialogue. These are services for which there is sound and solid evidence for supporting their use. Numerous studies have emphasized the value of these services in the management of many chronic health conditions like cancer, diabetes, heart disease, and HIV infection. One study by the Rand Institute found that, on average, only about half of Americans receive recommended colorectal cancer screening, and only 25% of diabetics receive the appropriate number of hemoglobin A1C tests each year. The Center for Disease Control and Prevention has recently estimated that tens of millions of Americans are not getting the preventative services that they truly need. The reasons for this significant underutilization are many. They include lack of access to primary care, inability to afford basic health care, lack of health insurance or significant underinsurance, and ignorance at many levels. The impact of all of this is dramatic. It has been recently estimated that the annual financial burden of poor health in the United States is nearly $600 billion, half of which is attributable to lost employee productivity. So, we need to focus not only on the impact of wasteful spending on low-value healthcare services like unnecessary diagnostic tests, but also on the underuse of high-value diagnostic services. Underuse is real and it is expensive. It needs to be part of our Choosing Wisely conversation as pathologists, clinical laboratory scientists, clinicians, caregivers, families, and patients. If you're interested in more information on this topic, I encourage you to look at the choosingwisely.org website.